Hey, and welcome to the month of October. It is getting cooler outside, which we all welcome here in Houston. But it's also a month that we are remembering and celebrating Breast Cancer Awareness Month. And typically we do these videos, and it's women we're bringing to you. We have a slight twist this month from our friends and partners at UTMB Health. And we are going to be talking with a dad, grandfather who was diagnosed with breast cancer, and hearing a little bit about his journey and from the medical team who helped treat him. So, thank you for joining us. My name is Megan Clanahan. I am the co owner of Houston Moms. Hey, Dr. Silva, it's good to see you again.
Thank you. So good to be here again.
And Dr. Silva, can you remind us a little bit about what you do? We've talked a couple of times, but just for the people at home.
Sure. Yeah. I am a surgical oncologist who specializes in breast cancer surgery. I work mostly in the UTMB campus in League City and at our comprehensive breast program there. And I'm the director of our breast cancer program there.
Great. Thank you so much for being here. I know your time is precious.
Mhm.
So we appreciate that so much. Our special guest today, um, Bill Garwood, up there to my left. It's good to have you with us.
Thank you. It's good to be here.
Can you tell us a little bit about yourself?
Sure. I work in finance, ironically also for UTMB. I'm the AVP of finance for suburban hospitals and based out of the Angleton location.
Okay. And I understand you're also a dad and a grandfather of two.
I am the proud father of two girls, two adult girls, and a very proud pawpaw of two little granddaughters, ages 5 and 7.
I was going to ask you what your name was, but Papa fits you perfectly. I don't know. We haven't known each other long, but Papa looks like
Thank you.
so lots of estrogen in your household.
Yes, it's an estrogen-rich environment.
Yes. So when we think of breast cancer awareness month, we're typically talking about we're raising awareness more. It feels like for women, right? Like we're talking more about save the tatas and all of those things. Um, but you're a man who was diagnosed with breast cancer. Can you tell us a little bit about that journey?
Well, I was aware that there was a rare chance that men could get breast cancer, but I never thought that it would affect me personally. Late in 2018, I was laying in bed one evening and felt a slight pain in my right breast near my nipple, and just it kind of felt like an ingrown hair, and didn't really think much of it. And the next day at work, I was just sitting here like I am doing now, and I got this really significant pain in my nipple. And I believe it was the only time I ever got that pain, and it eventually subsided. But when I went and started pressing around on it to try to figure out why I was having this pain, I felt a mass underneath the nipple, and that's what led me to my journey that has led us here today.
My gosh. And and we're not gonna talk about like poking fun at men or whatever, but a lot of times you guys do kind of ignore symptoms and things that are happening to you. I've been married for 21 years and I'm like, maybe we should go check that out." Um, what prompted you to take the extra step? Why did you do that?
Well, I knew that when I felt something behind the nipple, that there was something going on, and to be honest, I told my wife what happened, and I guess I was in a bit of denial and not knowing, not being sure if I should go see the doctor. Although in my heart, I knew I needed to go see the doctor, and my wife said, "No question about it, you're going tomorrow." And so. But the next day I was in with my primary care physician, and the day after that I was at the League City facility in their breast health clinic area, having a mammogram, an ultrasound, and a biopsy all in the same day.
Ooh, things you did not see coming, and we'll
No.
get back to that. Dr. Silva, how rare is breast cancer in men?
It is rare. Of all the breast cancers diagnosed, it's about 1%. And among men, if it's about 1 out of every 750 men is diagnosed with breast cancer. So it's not common.
So, statistically, how do men do, from a breast cancer survivorship standpoint?
Interestingly, the stages that men present is pretty similar to when we find women's stages as well. Um, Unfortunately, the long-term survival in men is a little bit less than women. It's still very, very successful, and Bill is a attestation to that. But it's a little bit less. They don't do quite as well as women.
Interesting. So, what is the screening process for men? Is there one? Or what should men be doing?
That's a great question. There's not really a screening recommendation for men in general. Even in women these days, we don't necessarily tell them to do, consistent breast exams. We caution people to be body self-aware. So I think that applies to men as well. Be aware of your body, just as Bill noticed that there was a change, and that was really important. Now, that said, men who get breast cancer are much more likely to be carrying one of the breast cancer genes. Now, Bill was tested and he was negative. Isn't that correct, Bill?
That's correct.
And so that basically just means we probably haven't found the gene that maybe he has yet, but of the known breast cancer genes, he didn't have one of those. However, if we do have a man who has a breast cancer gene, then his chance of getting breast cancer is much greater. Instead of being, 1 in 750, it's going to be anywhere from like 1 in 10. So it's much
Mm.
more likely he might get breast cancer. And so in those men, we would follow the same kind of high risk screening that we follow for women, a clinical exam by a physician, even mammograms, just the regular route that we would take women as well.
So I find it interesting because, again, we don't talk about this enough, I don't think. Um, as an anecdote, my husband had a colonoscopy last week, and
I'm
he
sure
turned
he's happy
5.
you're sharing this information.
Oh, he doesn't care, thankfully.
Okay.
No, but he turned 45 and he was like, I'm gonna get a colonoscopy because that's what I'm supposed to do when I turn 45. And so I'm like, cool, high five. Like, way to go take care of yourself. Um, when we were checking out or getting the discharge paperwork, the woman was telling us, about the follow-up procedures for a colonoscopy, 5 years. If everything comes back good, it might be 3 years. If anything was precancerous, they took out. But they also mentioned men are not breast cancer immune, and you need to be doing, I guess, like to your point, like saying body aware. I've never heard them say anything like that. So I think it's awesome, like from
Yeah.
an awareness standpoint.
No, good on the person who was doing your discharge. Seriously, that was very thorough, very complete, over
Yeah.
and above. That's great.
No, and my husband's like kind of still high. And so he's like, yeah, check it out. And I'm like, no, you don't. I think I had to remind him later of that. But Bill, had you done anything, or did you just, it was kind of the pain
I
that
was
came,
just, it
but
was a normal lifestyle. And then one evening, the very minor dull pain. And then the next day, a very significant pain that just kind of stopped me from doing what I was doing.
um,
What is going on? And that was when I did that, I felt the lump.
I mean, things you didn't expect. So, how is this? How are they treating your family? I mean, I know it didn't test
So,
necessarily
so I
positive
went, I
for.
went through genetic testing as Dr. Silva indicated, and they did not find the genes that we're aware of that cause breast cancer. Although I do completely agree with Dr. Silva that we probably haven't identified all of the genes that contribute to breast cancer. And I say that because my mother actually died at age 35 from breast cancer 50 years ago. And there's other family members that have had breast cancer in my family history. But I'm sorry, I don't remember the original question now.
No, that's okay. So, I mean, are there special steps that your family members are taking, especially since you have
Well,
2 daughters
my
and
daughters are in their early to mid 30s, and they've already begun doing regular screening for breast cancer earlier than one would typically begin, just because of the family history and their father's history.
Dr. Silva, kind of given those circumstances, is that what y'all recommend from a family standpoint?
Yes. So if we don't have a genetic mutation that we've identified, then we say it's more like a familial breast cancer. It's in the family, as you mentioned, his mom, etc. But we don't really know how it's passing or
Mm.
how that's working. So we would say that 10 years before the youngest person who got cancer, the other family members should start being screened. So, as an example, if your mother was 45 when she got breast cancer, then that woman's daughter would start screening at 35. So instead of screening at 40, which is the regular age, she was screened at a younger age. So 10 years before. Obviously, if the person is 60 when they get diagnosed, well, you don't start screening at 50, right? You still start screening at the regular time period, which is 40.
That's such important information for any of my women out there who are listening to this as well, is, the 10-year rule. I didn't know that. But great and valuable information. So, Bill, you are cancer, do we say cancer free? I mean, we're 5 years
I
old, right?
I have considered myself cancer free since Dr. Silva performed the mastectomy on me back in January of 2019.
Perfect. And so 5 years, when you go to see Dr. Silva, what do those annual checkups look like? And Dr. Silva, what are you kind of looking for in those? Sorry, I'll start with Bill over here.
Yeah, go ahead, Bill.
So they're very comfortable. It's a check-in to just see how I'm doing, and Dr. Silva takes a look at my scar, and she palpates the my left breast and my around my armpits, and to make sure nothing else is going on there. And it's typically short, and I always look forward to them.
Well, who
So,
wouldn't? It's Dr. Silva. She's great.
so the things that we're looking at when people come back after having had breast cancer is we're looking for any signs or symptoms they may be having that could be attributed to a return of their breast cancer. So we'll ask them other things about other body parts, because the areas where breast cancer can also spread to. So we'll ask them about symptoms that might be related to their lungs or symptoms that could be related to their bones or their liver. So we'll ask them general, those are called the review of systems. So we'll ask them general questions about that. We do a breast exam, both on the side that's had the mastectomy and on the opposite side. And as Bill mentioned, we check for lymph nodes up underneath the arms and above the collarbones. For people who get what we call a local recurrence, meaning that it comes back in that same breast, and generally it comes back in the same area that it was. And oftentimes it'll be a small nodule on the skin, maybe a little nodule underneath the skin. So generally, something that you can find with palpation
Mm.
in someone who's had a mastectomy. Whereas in the case of a woman who's having a mammogram, we'll be looking at in that specific area, especially when she gets her mammograms, if she's had a lumpectomy after that. But in
Okay.
Bill's case, it's basically limited to his physical exam.
Okay. I may go off script here a little bit, but was there a case of reconstruction? How does that look like for men? Is there any need to kind of reconstruct the area?
Bill, what do you think?
Well, I mean, I will tell you that my understanding is that there's not much to work with in terms of reconstruction, and I'm going to let Dr. Silva talk about that. I'll share that and confide in you that I wish there were an option for reconstruction for men, because shirts don't fit quite right, and well, that's really the only thing that I can think of.
So in Bill's case, just like in some women's case that don't have reconstruction, he's basically it's flat on that side with the scar that goes across the chest. Now, obviously, he still has the nipple area and the small amount of breast tissue that all men have on the opposite side. So actually, just in the last few years, we've started to a little bit change our approach. And so these days, potentially Bill could have been a candidate for lumpectomy. I'd probably not, because his tumor was kind of right in the nipple, but sometimes now, if the tumors are further away, even in men, we can do more of a lumpectomy. That does then mean that they get radiation, just like a woman would after a lumpectomy. So breast surgery continues to evolve and change. The way I practice as a breast surgeon now in no way resembles the way I was taught when I was a resident or a fellow. It continues to change. So we are looking more at reconstruction in men, as far as trying to start out by making the scar not quite as dramatic if we can. But that's pretty recent, philosophy change.
I appreciate you both answering that question. I know that kind of came out, but I was curious, and I think it might be helpful to someone to know what to expect. Um, so Bill, what's life like for you now?
Life is great. I mean, I suffer some minor side effects from the chemotherapy, and I as a result of the radiation therapy, I'm constantly stretching my arm and armpit because of constant tightness. But I've gotten used to that, and I call it my new normal, and so I live life just as normally as I lived life before. There's nothing that I can't do now that I did before I had surgery. It was just a hiccup in my life history.
What a great perspective. We're so glad you're here. I'm sure those precious grandbabies are so glad too. Dr. Silva, I know we went through kind of a few different things. Is there anything I missed that you would like people to know about male breast cancer, or just breast cancer awareness in general?
I think that, I think the key to focus on is how well we're doing as far as people going on to live out their normal lifespan. Obviously, we're not at 100%. We still have patients who succumb from their cancer or their cancers return. But the much, much higher percentages are people who go on to live their normal life, just like Bill has done. And I think that's the thing to focus on, because it's so scary when you get this diagnosis, and you're just people are, in my experience, talking to people, they're so overwhelmed, and everybody is very worried that they're not going to see their grandchildren grow up and all those things. So I think just focusing on how well we're doing as far as what we can offer patients, all the new immunotherapies that are now available. Many times women, and I don't mean to be saying it's women and men, but don't actually end up needing chemotherapy anymore for their cancers. We've learned so much. So I just think focusing on the positive and how well we're doing and how many people are surviving. We've still got a ways to go. It's not perfect, but most people do well.
I think that's so encouraging because, as a mom, I'm 44. I had to think about it. I'm 44. Um, so my mother-in-law had breast cancer. She's a survivor. I could throw a stone and hit a handful of people who I'm close to that have breast cancer and are still with us. And I think the message of hope is really important. Also, just sharing Bill's message of just like I felt it, and then I went to my primary care physician. Um, Bravo to you, sir.
Thank you.
And I think, and not only just a message for men, but I think we all need to have, we push at every video, but like if you don't have a primary care physician, you should have one. So that you can run these things through, and they can be like, oh, I don't know. Or they can refer you to specialists like Dr. Silva down at UTMB Health so you can get stuff taken care of. And so if you don't have a primary care, going to drop a link below where you can find one that's in your area in the southeast area of Houston, and they'll take care of you. I promise. Um, Bill, Dr. Silva, so good to have you here. Thank you so much.
Thank
Thank you
you.
for
It
having
was
us.
Yeah, so we have a couple more links that we're going to drop below. There's a great article that they did about Bill's story and all of the care that goes in a little more detail than what we talked about today. We're going to drop that in the comments below so you can read that. Also, as well as to the breast oncology team at UTMB Health. So if that is something you're in need of, if you need to figure out how to schedule a mammogram, maybe you've never had one before and it seems a little scary. I'm going to challenge you this month to go ahead and get it scheduled because we need you here. We want you here, and this is something preventative you can do. So, thank you all so much for joining us, and we will see you back next month with another informative health topic from UTB Health. Thank you.